Thank you. Now we have Now we have public testimony. We're getting late in our day. I really would love to have the first panel come back, but right now I think it's only fair that we have the public testimony. If you could just, as quickly as you can do it.
Thank you, Chair Brown, Chair Bonta, and other members of the committee. I'm Gary Passmore, and I'm Vice President of the Congress of California Seniors. And most of the people that you're concerned about are the people that I lobby for and represent in this building. I've been doing it for 12 years and 9 months, and my guess is that 11 of those years I've been before one or all of these committees talking about the exact same issues and problems that you heard about today. Nothing has changed. We are in a time warp. And I no longer, years ago I used to get excited when I heard intelligent and informed questions that suggested that you folks on the dais were going to fix something and no fault of your own, but I've lost all that faith. This is a problem of leadership in an agency in state government that probably money cannot fix, at least not in the short run, because they don't know what to do with that money. And legislators have been complicit in this because in one of those years that Ms. McGinnis talked about when everything kind of went to hell, the legislature approved a 300-position cut in the staffing of this program, even though it's not general fund money, it's fee-supported. So you didn't save yourselves a dime, you just took a whack out of a state agency to feel better. And that isn't your responsibility or problem. Here's what you need to focus on. You need to force specific actions that management of this agency have to take, or come back here and be responsible. Don't do this again in 3 years after you've just allocated $25 million and it's disappeared. Number two, you need to think seriously about moving this program out of a bigger state agency called the Department of Public Health and make it directly responsible to do this function under the governor and under your guidance and oversight. This is a serious problem. The most frail, vulnerable people in this state are at risk because of all of the statistics that you've heard today. And you all know that.
Please wrap up.
And I just want to summarize by saying you're not hearing about two other things. You're not hearing about all the complaints because you cut the long-term care ombudsman program some years ago, and they used to generate 55,000 complaints a year. Now they're under 40,000. So you're not even getting all the complaints that we used to get when we weren't handling them. That's one of the reasons why they're catching up with caseloads. And the second one is that, you folks have got to come to grips with the fact that we're dealing today with an incompetent program serving 4.8 million seniors, and we're going to soon have 10 million seniors in this state, and that number, as you know, Chair Brown, is just going to wash over programs like this and turn them into chaos. Thanks.
Thank you. It's a silver tsunami. It really is.
Good afternoon, Madam Chair, Mr. Chair, committee members. I'm Joe Rodriguez. I'm the California State Long-Term Care Ombudsman. The Ombudsman program is an independent advocacy program located within the Department of Aging, but my opinions today do not reflect the opinions of the Department or the Health and Human Services Agency. I won't rehash the concerns that you've already heard this afternoon. We know what the problems are. We know what the concerns are. What I do want to say is this. Ombudsmen identify, investigate, and resolve complaints of residents that affect their health, safety, welfare, and rights. We resolve problems for residents at the lowest level possible in the facility. We oftentimes keep problems from going into the more costly regulatory system. Last year alone, Ombudsman representatives throughout the state investigated more than 39,000 complaints from residents of long-term care facilities. we were able to resolve or partially resolve 73% of those complaints to the satisfaction of the resident. What we need is additional resources for licensing, but we also need additional resources for the Ombudsman program to do our work of problem solving for residents. We're their advocates. We can prevent a lot of problems from becoming worse, but we can't do that with limited resources. Thank you.
Members, thank you for having this hearing. It's very important. I'm Brandon Tartaglia with Disability Rights California, and I'd like to echo the concerns and the outright frustration that Ms. McGinnis showed about the issues that we're seeing here today. I'd also like to express support for both of their bills, AB 927 and Chair Brown's bill, AB 348. We also support the governor's idea of giving the department additional resources, but only if there are some timelines around how long these investigations can take. We've seen some of these investigations into a death take up to 7 years, and we've seen the same incidences happen over and over. In one facility, a 4-year-old boy died because he removed his breathing tube, and during the 3-year investigation, the same exact thing happened to a 3-year-old girl in the same exact facility. We really think that these things can be stopped or at least slowed down if we can get some more resources and put some timelines around how long these things can take. Thank you.
Thank you. If you would go briefly, and so there's a line of folks behind you, I'd appreciate it.
Good afternoon. I'll be as brief as possible. Thank you, Assembly members, for having this really important hearing. My name is Cynthia Harding, and I am the Interim Director for Public Health for Los Angeles County. A lot has been said about our performance under the contract with the state for health facilities inspection. And it's true, our performance was poor, but I'm here to say today we have done a number of things to fix the program in Los Angeles County. We took all of the state quality review findings very seriously, all of the audit and control findings in Los Angeles County very seriously. We launched our own internal reviews and took all of those information very seriously. At the end of the day, it became very apparent there were a number of changes that we made, and Ms. Boston summarized those very nicely, about new management, making the policies and procedures clearer for our staff, putting in better training for our staff, a number of things we were able to do. But at the end of the day, we found we were severely under-resourced. We were being held accountable for 100% of the workload, but being resourced at less than 50%. And that has a huge impact on your ability to do quality work. So we support the governor's proposal to give additional funding to this program. It's a great start. But we've got to resource this program appropriately if we want to see quality work and work on behalf of these vulnerable residents. Thank you.
Thank you.
Hi, I'm Terry Williams, also from Los Angeles County. The health facilities program came under my purview under environmental health. I'm the Assistant Director of Environmental Health under Public Health about a year ago when it became apparent that we had a lot of problems in-house. I'm not going to repeat what Ms. Harding just said, but I primarily wanted to address your concern. Although CDPH does not use a ratio of inspectors or evaluators to facilities, that information is available. And there is a report that I was able to pull entitled Facility Count by Facility Type and District Office. And you will see on that very clearly, and I just used 2 for an example, the ratio of evaluator per facility for Los Angeles County is about 30 to 31 for each of our offices. In Riverside, which is the CDPH, Riverside District Office, it's 8 to 1.
Please wrap up.
Okay.
We're losing our... It's
no,
past
I understand.
4:30. We're losing our folks.
Yes. So what I am saying is all evaluators responsible for 30 facilities in Los Angeles County is too much. Thank you very much.
Good afternoon, Chair members, and thank you so much for the hearing today. Michelle Cabrera with SEIU California, wanted to just hit again on these themes. It's not an either or when it comes to fixing the problems here. This work is mandated by the federal and state governments, and so you can't talk about either staffing up or improving leadership at the top. We really need to do both. It's not either the backlog or ongoing work. It's both. We do have a tall order on our hands, but we need to start somewhere. And so the governor's budget proposal is a starting point. It's not a complete proposal. It's not taking us all the way there, but we're very heartened by the committee's oversight, by the attention to this issue. We just have to keep it up. Recruitment and retention, low morale, high turnover. These are issues that, as you heard today, are not going to be solved by not adding staff. And again, we may lose some people, but as we're fixing it in the process, hopefully we're going to keep some of those people.
Thank you.
We agree profusely that the policies and procedures and the regulations need to be clarified. This issue of when to do an ERI is adding to workload, and then 4 different timekeeping systems. This is something that hasn't come up today, but it is an incredible inefficiency. Hubbard had recommendations on that. Those recommendations are not being reviewed and considered seriously, and so we would urge the committee to follow up on those items as well. Thank you.
Thank you.
Good afternoon. I'm Lisa Coleman. I'm the Executive Director with CALCOA, the California Long-Term Care Ombudsman Association. This is a hard discussion, but I think where we as ombudsmen help, it's reducing the workload for DPH. I'd like to point out one example. San Luis Obispo received a $2 million annuity. A resident died and left the program money. In 1 year, using supplemental income, the program went from 1.5 employees to 3 employees. With the addition of 1 employee, they went from 9 volunteers to 23 volunteers. With the addition of that supplemental income, they went from 1,100 unannounced facility monitoring to 2,800 facility monitoring. And how this helps DPH? The year before they received this funding, there were 26 allegations of elder abuse in skilled nursing facilities. In 1 year, because of the presence of the ombudsman, we went from 26 allegations down to 4. How fast could we get that 4-year backlog completed if we used the volunteer ombudsman program to reduce the allegations of 26 elder abuse down to 4?
Thank you.
Good afternoon, Chairwoman Brown, Chair Bonta, members of the committee. My name is Jed Hampton. I'm the Director of Policy for Health Services for Leading Age California. Leading Age California is a not-for-profit association that represents not-for-profit providers of assisted living, skilled nursing care, affordable senior housing, and community care living. I will be very brief since most everything has been touched upon, but our members do feel that the entire survey, certification, and enforcement system should be completely reassessed. We believe that healthcare delivery has changed over the years, and we think that regulatory oversight should be changed as well. We are supportive of the timelines for the completion of investigation and are supportive of your bill, Chairwoman Brown. And we would like to see some more consistency with self-reported instances and more consistencies at the district offices under licensing and certification. Thank you.
Thank you.
My name is Carol Herman. I'm the president of the Foundation Aiding the Elderly. I want to just support everything that's been said today. I have been doing this work for 32 years. We file at the minimum of 1 complaint a week, if not 2. The backload, we brought the lawsuit recently against the department for their failure to investigate nursing home complaints in a timely manner, and I support the bill so that we can get something in writing here that forces the department to clear out these investigations and complaints in a timely manner, because when a complaint is issued by a member of the public or my organization, there's serious complaints: dehydration, bed sores, malnutrition, and the delay by the department is inexcusable, if not criminal activities that are going on. So I support the bill for a time period so that the department can adjudicate these complaints in a timely fashion, because when a complaint is issued that's serious enough, it puts the department on notice. There's problems in that facility. These complaints are not for bad food.
Thank you.
Thank you very much.
Hello, members. My name is Kim Whitnack, and I'm with the Chico District Office of CDPH. I'm a nurse facility evaluator nurse. I've been there 9 years, and the 9 years I've worked there, there's only probably about 5 of us that are still there. So retainment is a big issue with salary. It costs supposedly $40,000 to train each of us. They get trained. They take their SMQT license. They go and become nurse consultants and make 2-3 times more than what we make. So the ones that are here, that stay, are very passionate about patient care and quality of care. And so retainment is a big issue. The new hires have to put out their own money for academy, for motels, for food, and then aren't reimbursed. So they come to me and say, I can't afford this job. I can't afford to work for the state. Here I thought I had this great job with the state of California, and I can't afford it. So retainment is a big issue. Ever since the complaint process became abbreviated, we were instructed that if we had a finding, we had to expand the sample, which prolongs the complaint process. For example, if we have a fall that resulted in injury, we have to go back and pick 3 more falls and investigate that to see if it's a system problem or an isolated complaint process. So these are the things that we do face. It is imperative that a nurse is an evaluator and not just a facility evaluator. In the state of California, LVNs cannot assess, and they do not have the clinical knowledge. If you don't have nurses, you'll be setting yourself up for more lawsuits. Thank you.
Thank you very much. Ooh, this has been a day. I will not be able to call the panel back up because we're getting ready to knock 5 o'clock in the head. But I would like to just say to the Ombudsman program, I have asked that $4.4 million be put into the budget for the Ombudsman's program, and I have a letter and so forth that we've sent. So we're working on it. But I'd like to give some closing remarks, and there's some things that I can see that we can do to make it better. I think whenever I opened up, I said leadership is a matter of attitude, and it's contagious. When leadership, the attitude of leadership is good, it is so contagious that it goes throughout that agency. So for me, that's something that John Maxwell says, and if you really want to know how to be a great leader, read some of his books. He's pretty good. I'd like to suggest, though, a deputy-level appointee be placed individually in charge of improving the procedures within licensing and certification with specific responsibility to the needs of skilled nursing facilities. I want to hear regularly from that person about their firsthand experiences accessing unannounced into the facilities that persons will have jurisdiction over and providing feedback on their observations. I want to see improvements by the time the May revise arrives. That's just around the corner. Any further erosion, and I believe we need to call upon the courts to install a third-party overseer. I'm embarrassed by this disgrace. It does not do justice to the people of California, and I think we ought to ask for a report on all of the salaries that we're paying all of the executives in this agency so that we can see what we can do to control the issue and how we can start setting up better leadership, how do I want to say it? Standards, right. Better leadership standards. I thank you all for coming out today, and now Mr. Bonta will close.
Thank you to all the witnesses and members of the public that participated today. I really appreciate your engagement and involvement and participation in today's very important hearing. I really appreciated the different contributions from so many to help amplify and inform today's discussion. I want to thank Assemblymember Brown for co-chairing, as well as all of our colleagues who participated, Dr. Wood, and for staff who helped organize today's hearing and put it together. It's very important that we continue to focus on this issue until the necessary improvements are made. And I want to close by saying that we recognize that licensing, certification, and regulation of long-term health care facilities is a challenging and complex endeavor. I also want to acknowledge the department's commitment to change and improve, as well as its work that it's put in so far to help get back on track. but there's absolutely no doubt that we simply are not doing enough and we need to do better. We heard up here from many members in our tone and in the substance of our comments and questions, a lot of concern, a lot of disappointment, a lot of frustration. And I look forward to working together in the effort to help us get back on track and make the improvements that are necessary. I think that some of the comments that were made today about supporting the budget increase, but also including some performance and conditions and requirements, perhaps around time frames for completion of investigations, could be a path forward, as well as funding for the long-term care ombudsman program. So I think there are some places where we can make progress. I appreciate the support for the two bills that are moving as well. And as I stated at the top of the hearing, the protection of nursing home residents is a top priority and of critical importance, and we're not doing enough at the moment. So we'll keep a close eye on this issue. I look forward to working with all of you that are here today as important stakeholders in this ongoing effort to ensure that the state meets its nursing home oversight obligations. Thank you once again for today's discussion. Look forward to working with you going forward. Thank you again to everyone, including our staff.